One of the biggest questions people ask after developing sciatica is, will this heal on its own? And in many cases, the answer is yes. That surprises a lot of people because sciatica can feel severe. Pain down the leg, tingling, numbness, sharp shooting symptoms. When symptoms feel intense, it's easy to assume something serious or permanent is happening. But most cases of sciatica improve over time. The body has a strong ability to adapt and recover, even when a disc is involved. This is important because many people immediately assume they need surgery or invasive treatment. In reality, most people improve without that. But healing on its own does not mean doing nothing. This is where people often get confused. Recovery is usually helped by movement, load management, and gradual return to activity. Completely resting and waiting for it to disappear often slows progress. The nerve and surrounding tissues tend to become more sensitive when movement drops too much.
On the other hand, trying to push through aggressively can also flare symptoms. The key is finding the middle ground. Enough movement to maintain tolerance. Not so much that the nerve becomes increasingly irritated. Walking is often helpful. Gentle movement is often helpful. Gradual exposure to normal activity is usually helpful. Another important point is time. Nerve-related symptoms often recover more slowly than simple muscle pain. That can be frustrating. People expect quick improvement, but nerves are sensitive structures, and recovery can take time. That does not automatically mean something is going wrong. Many people also worry when symptoms move around. For example, less back pain but more leg pain, or symptoms changing location. Sciatica can fluctuate during recovery. Good days and bad days are common. The overall trend matters more than individual days. Another important point is that scans do not always predict recovery. People can have significant disc bulges and recover very well. Others can have minor findings but significant symptoms. The body is more adaptable than most people realize. There are situations where further assessment becomes important. Significant weakness, worsening numbness, or changes in bladder or bowel function require urgent medical attention. But outside of those situations, most sciatica improves over time with the right management. A common mistake is becoming trapped in fear, fear of movement, fear of bending, fear of causing damage. That fear often reduces activity and slows recovery. The goal is not to avoid all symptoms, it's to gradually rebuild confidence and tolerance again. The key takeaway is simple. Yes, sciatica often heals on its own, but recovery is usually supported by the right level of movement, consistency, and gradual progression. The body generally recovers best when it keeps moving.